Now look at another type of amputation, and this amputation is the type that is done through the hip joint. So they call this the hip disarticulation amputation. Okay, so you can see it's through the hip joint. This person had his leg amputated through the hip joint. Later a prosthesis was put for him. Okay, this is cutting through, so just so you know, it's a major surgery, and this one, the entire leg is removed through the hip, and this separates the femur from the pelvis. So unlike a hemipelvectomy, which removes just part of the pelvis, a hip disarticulation preserves the pelvic bones, but it removes the entire limb. So what are the indications? Like, when will you need to do this? Maybe there's a cancer and the cancer is spreading. So maybe the cancers are spreading the thigh and hip joint. A severe trauma, this is where you have irreparable injuries. Then infections, where there's life-threatening infections that cannot be controlled, by other means. So also congenital issues. Okay. So surgical procedure said that the femur is separated from the pelvis at the hip joint. Soft tissues are carefully managed to create a stable closure, and also residual limb is shaped to allow sitting balance and also prosthetic fitting. They rearrange it so that they can be able to come and put this prosthesis later. So rehabilitation, this is when you now use prosthesis, basically for hip disarticulation. It's complex and often includes a socket. So hip joint mechanism. Okay, they use the knee, the foot. Now walking requires significant energy and training. The physical therapy focus on the balance, mobility and strengthening the trunk and opposite limb. The occupational therapy, where you are trying to help the patient to adapt to their daily activities and activity with one leg, just make them live with the reality. The psychological support, this is where you talk the person through the whole situation. So that's what we have for hip disarticulation.